You're watching NorthState Health, the North State's first local health program.
Good afternoon, I'm Tim Mapes. Thank you for joining us for NorthState Health, the only show dedicated to bringing you the information you need to live a healthier and a happier life. Our guest today is Dr. Ray Powell from Physicians Plan Weight Management. Dr. Powell, thank you for being here with us again today.
Thank you for having me.
All right, for the benefit of our viewers out there that may not be familiar with Physicians Plan Weight Management, let's start a little bit with your experience, how long you've been in the North State, and how you got into weight management.
I've been in the North State since about 2001. We moved from South Carolina here with my whole family. My family's from Redding and from Chico. And I got into weight management kind of a long way around, where I was actually an emergency medicine doctor first, and I got injured in Desert Storm in flying in the C-141 and the F-111, and I ended up becoming a disabled vet, and through my injuries I ended up gaining about up to about 250 pounds. And so I started really learning about nutrition through my father, who also did weight management, and it just became kind of a labor of love where I started getting into it full time.
Okay. Well, the patients would want to know out there that you definitely know what you're talking about. Talk a little bit about, just really quickly, your board certification that you have.
Right, I'm board certified in emergency medicine, but then I became board certified in bariatric medicine, which is the management of obesity as a disease. And then my third board certification is as a physician nutrition specialist, which really there's only about 44 in California and only one north of UC Davis, which is me.
Okay. Well, talking about Physicians Plan Weight Management, some people may wonder about the name of your practice.
Right.
Talk a little bit about, it's not just weight loss, but it's weight management.
Exactly.
It can be gaining as well.
Right, so my sign, I always tell this to people outside the building, is it doesn't say weight loss, it's weight management. So we deal with people that have to gain weight. We deal with people that have had chemotherapy, that have cancer, that are trying to gain weight. God, I've got liver transplant, kidney transplant patients. I have people that are on dialysis even. And so we're really looking at nutrition and making sure that they can live as healthy as possible.
Okay, so we are talking about weight management, so whether it be gaining or losing.
Right.
Today's topic, we're going to focus on somebody comes to your practice and they are either losing or gaining weight. Why does Physicians Plan Weight Management deal in facial aesthetics? What is that?
And we do facial and laser aesthetics. And so really what's happened is, over the years of doing this for 15 years, I've had people that are coming in that are losing weight, they're feeling better about themselves, they're eating better nutrition. They also want to look better. And I'm probably the #2 most vain person in Northern California. So it became kind of a labor of love, because I really started looking at myself as well as trying to keep as healthy and as youthful as possible. I'm not, you know, nobody tries to look 21 again unless you are 21. But it's one where the people get a rapport with us, that we just kind of delved into the aspects of really what we call non-invasive aesthetic procedures. So it's not plastic surgery, but more of the things that work on the surface. And this picture shows a great description of kind of the aging process that we go through. Okay. And so it shows the difference in the lines and the difference in the amount of what gravity does to us. And what we try to do is just make the people look better, just youthful and healthy, without making them look like they've had something, you know, dramatically done.
Yeah, and you were saying it's something that you kind of take your time to get these results, so people don't have to worry about having this type of procedure. And we're going to talk about some of the, you know, the products and the treatments that you do a little bit later in the show. But people don't have to worry when they see this that they're going to look like one of those celebrities that you see the
There's a
photos of.
lot of myths about Botox and about the dermal fillers and things like that we'll talk about, and kind of go through the kind of alleviating some of those myths, so that people really understand what the science is behind it, and the art.
Okay, and so you were saying this is also a science and then also a medical procedure.
Exactly.
You consider it.
Exactly. I'm very much in the aspect that it's a medical procedure that has to be taken care of one-on-one with the patient as well as the physician. It's not to go do a Botox party somewhere or anything like that. It's really an issue of making sure it's done in a medically safe way.
Okay. Now, why would somebody need to have this done if they were having, you know, either having weight loss? Is this something that comes along with, you know, they start losing weight?
They do. They feel better about themselves. Then they really want to look better, and they start really looking at themselves more. A lot of people that are overweight, they really don't take the time to look at themselves, because they're really in kind of almost a self-imposed denial. And as they start feeling better, they really start saying, wow, you know, I could look better than this even. And so they want somebody that has the skills, and as well as they have the rapport with, to do the procedures for them.
Okay, so it's something that one goes along with the other as they start feeling better.
Right.
Well, why not just keep going?
Exactly.
All right. Well, thank you, Dr. Powell. We are going to talk about the products and some of the procedures that Dr. Powell does in his practice when we come back. So we still have a lot of information to get to. You're going to want to listen to here on NorthState Health. So stay with us just after this 1-minute break. But for more information on today's topic or any edition of NorthState Health, just go to our website at krcrtv.com/NorthState Health. You can watch today's episode in its entirety from your computer or laptop. We'll be right back.
Welcome back to NorthState Health, the North State's first local health program.
Welcome back. Our guest today is Dr. Ray Powell from Physicians Plan Weight Management. Today we're talking about facial aesthetics, which goes along hand in hand with, or face to face, as we were saying, with weight loss or weight gain, you know, and some people may be doing these. A lot of people are familiar with the word and the procedure Botox.
Right.
And we are going to talk a little bit about that, or a lot about that actually, in the next segment. But there are some other products that you have at your stores and some treatments. So let's talk about those that maybe people haven't heard of them.
Well, at the offices, we have skincare product lines that we use. And the first one we use, which is a really high-end product line, is called Vivite. And Vivite is a product line that's medical grade. It's only sold to physicians under prescription that the people take home with them. But it uses antioxidants as well as glycolics and different chemicals that really help instill moisture back into the skin and help improve the whole tone of the skin. Then we go into another product line, which is called Skin Medica. And Skin Medica also has skincare lines. It's actually now been bought out by Allergan, which owns Vivite, so eventually it'll be under the same line. But these are where we use chemical peels. So we're going from surface to a little bit deeper under the skin, where we're using different peels. One is, for example, called Illuminize. And Illuminize is a type of peel that you can have done, and literally that night you can go to a dinner party. It gives you kind of a nice warm glow and helps kind of moisturize the skin. But then we have ones that are much deeper that also use glycolics and retinoics that help really take off that first layer of skin. So there will be a little bit of skin peeling afterwards for a day or two.
Okay.
Then we go into even deeper of a procedure, which is called HydraFacial. And HydraFacial is a machine that we use that actually not only takes the dead skin off and the sebum, but also helps put serums into the skin. So I brought a video that I'm going to show here that shows kind of the science behind the HydraFacial machine.
Okay.
The HydraFacial uses the unique patented HydroPeel tip to exfoliate dead skin cells and extract impurities, while simultaneously cleansing and hydrating the skin. The serums soften the dead skin cells and sebum, making it very easy to peel off those impurities. The spiral design of the HydroPeel tip gives it multiple abrasive edges, which means that the skin is exfoliated several times each pass when the tip planes over the skin. The spiral design also allows the serums to stay on the skin longer to boost performance and absorption time.
Now, you said that some of these, the products, you know, they can take them home even though they are by prescription. With something like that, is that an inpatient procedure when you use that
the
machine?
HydraFacial is an incredibly comfortable procedure. It's one where it's a lunchtime procedure. They can go right back to work, and it just really gets all of the dirt and the oils out of the pores and also helps instill those serums. But then what they'll do is they'll also take the Vivite product lines home with them to help keep that moisture going, and they can get the HydraFacial procedure done, you know, once a week or once a month, just to kind of keep the maintenance up with it.
Okay, I'm talking about, you know, the first two products with the peels or the creams or that type of thing. Are these things that you would use over a long period of time?
Exactly.
Or?
People will use them periodically because, you know, everybody says, well, how long does it last when you talk about any kind of procedure? It's how long you take care of your skin. I mean, it's making sure you use sunscreen. It's making sure you do good hydration, good nutrition. So even, you know, even a full plastic surgery facelift can only last sometimes 5 years, but it also depends on whether you smoke or whether you're in the sun and baking your skin and not using sunscreen. So it's a constant renewal that you have to do with the skin because it's constantly growing.
Okay, so constantly renewing. Are these things that you could use, and then if you started seeing some changes again, you could use them again?
Exactly. Oh yeah, you use them on a regular basis to keep yourself in that healthy look.
All right, perfect. Well, we are going to talk about even getting a little bit more invasive. We're going to talk about Botox coming up after the break. So we still have much more to come. Don't go away. NorthState Health will be right back. And we are back with Dr. Ray Powell from Physicians Plan Weight Management. Today we are talking about facial aesthetics, and we are, talking about some of the work that you would do for some patients. And a lot of people are familiar with Botox, and we're going to talk about that right now. But some people out there may be saying, Dr. Powell, you're not a plastic surgeon or a dermatologist, but you do have a lot of experience doing these type of procedures.
Right. We all go through additional training for a lot of these procedures, and I'm also an emergency medicine physician, so I've done a lot of, technical procedures in the ER. So it's really more of the expertise of doing it, and we've been doing it now, and I've been doing it for over 10 to 13 years, depending on the type of procedures, really since they become FDA approved.
Okay, that's great. So they are in good hands when they come to see you for these procedures. Now, let's talk, we talked about the creams and then also some of the, facial peels and that type of thing. But now let's talk about what people have heard a lot about, and that's Botox, and then also another product.
Right, we have another product, which is a newer product called Dysport. And this picture kind of describes the aspects of wrinkles in one great picture. You're looking at wrinkles, but you're also looking at what the action of the muscle does to cause those wrinkles or lines. And so Botox has been around since about 2001 as an aesthetic procedure. It's actually used to be called oculinum back in the 60s. And so it's been around for a long time. We know what it does. Dysport is a newer product, which is basically a competitor for Botox. It uses a different part of the protein of the molecule, so it actually helps people that the Botox might not be working as well on. But Botox and Dysport both are really what I call preventive medicines. They're trying to keep the lines from forming deep. It's not to make you look paralyzed. It's not to make you look like some kind of freak of nature. It's to make you look healthy and really natural. So I've got some before and after pictures. This first one is showing a central crease that the woman gets that's kind of a familial trait that she has in her family. And by using small amounts of Botox around that muscle, you can see the one on the next side just is basically with her squinting also, and there's no line.
Now with a procedure like this, is this a one-time injection, or would you do this over a period of time? It lasts
about 4 months. It takes about 4 to 7 days to kick in, and it works for, it continues to improve about 30 days, but then it lasts about 4 months. So the way I describe it as a preventive medicine, if she comes in 2 to 3 times a year, it's going to keep that line from forming deep. The next one is a before picture, and the little black dots are where we're going to put the Botox in. And then the next picture after that is about a week later, where she's really trying to squint, but she can still show a little bit of action, but it's not causing the pinching.
Amazing difference, though.
Yeah, it makes a big, big difference. It just makes them look just healthier and less stressful. This next one also shows the pinching of 2 lines. They call this the number 11. And then afterwards, you can see she's really trying to squint, and she's not making those deep lines anymore. And any lines that are left will kind of resolve over time. So here's another before, deep lines. Afterwards, you can see with the next one where she's really trying to squint, but those lines that you still see will really gradually over time just kind of go away if she keeps the Botox up. The next one is a younger lady who's just starting to get the beginnings of that, and she's really starting to notice that line along her eyebrow. So then afterwards, you can see that she's just really kind of smoothed it out. So it's good for people that are even in their 20s and 30s all the way up into the 60s, where they're just trying to give back that healthy appearance to the expressions. And we can use it in the brow area, the forehead, crow's feet. We even do a little bit in the upper lips as well as in the bottom of the face.
And you were showing the photos from the younger woman there. And I was going to say, is this something that you should start earlier to kind of prevent this from happening, or is it something that you wait?
It really depends on the genetics of the person and their personal preference on whether or not they notice it and whether or not they feel like they need it. We leave it up to them.
Is there such a thing where you would have these, where you would have these procedures and you have them and then they stop working over time after a certain point they won't work?
Some people, maybe 5%, will notice that the Botox isn't lasting as long, and so that's when we'll switch over to the Dysport, because it's one where they're not getting kind of a resistance to it, and so the Dysport will work just as long as originally the Botox did.
I was wondering, say if somebody switches to the Dysport because the Botox isn't working so well, is it one of those things that you may be able to switch back and forth?
You can go back and forth, exactly. There's no problem with that.
And then one of the big questions I'm sure patients always ask about, you being a doctor, the pain factor. What do they have to deal with? What are they looking for?
My personal philosophy with any of these injectables as well as lasers is you don't get a diploma for being in pain. So we make it as comfortable as possible. We use numbing cream, we use ice. We really take the time to defray any of the worries that the patient has, so it really goes quickly, and they just say, my God, that's it? You know, they had all this drama that they built up, but then when they have the procedure, it was just really quick and easy.
Yeah, sometimes it's just the anxiety is worse than the actual procedure.
Exactly.
So that is good to hear.
Right.
Well, Dr. Powell, you did mention lasers, so we are going to talk about those a little bit in the segment coming up. So we are not done yet. There's still much more to come here on NorthState Health. We're going to be back in just 1 minute, so don't go away. Welcome back. We are continuing our discussion with Dr. Ray Powell from Physicians Plan Weight Management about facial aesthetics, and we were talking about, you know, Botox injections, which a lot of people are familiar with. But let's, moving on from that, let's continue our discussion and talk about another product.
Right. The next product is called Juvéderm, and it's actually going deeper, where we're actually going into the subcutaneous tissue to fill lines and also to help augment structures. And Juvéderm has been around for about 10 years as well. There's a lot of other dermal fillers, but this is the one that I really like using because it's not permanent. It's a material that really I describe as human clay. So I have a couple before and after pictures where this is a woman's lips before Juvéderm, and then we use numbing cream, and this is after, where we've injected it, so you can see a fullness to the lips, where it's again giving a subtle appearance, where it's not like the giant suction cup lips or anything like that, and it just gives back that fullness to the lip, which is really the amount that's being lost. This next one is where we can use the Botox and Juvéderm. So we're using it on the smile lines, and you'll see after, the next picture is after Botox, but she still has that line. And so we put Juvéderm in, and then the final picture is where that line is gone as well. And then it makes the Juvéderm last longer because the Botox is in there keeping the muscle from moving. So then the next one is where we're getting into the laser procedures.
Okay, yeah, so I mean, we're talking about going even deeper, so going in that order.
So the Cutera laser is a laser we use. It's a phenomenal machine. It's actually about 6 laptops in there, and it actually is what's called a platform technology, where we can do a multitude of different procedures.
Oh, wow.
We can do hair removal, vein removal, tissue tightening, photo rejuvenation. So I brought even more pictures. This is a chin where you're seeing a bunch of hair. And the way I describe it to patients is that the hair is color, and when we use the laser, it destroys that color, and it causes a destruction of the follicle, and then the hair is gone. Okay. The next one is where we do rosacea as well as connective tissue tightening, where it helps give back a nice texture to the skin. So you can see the before and after there, where it really kind of softens the skin and decreases pore sizes. Okay. The next one is where we're doing vein. So again, vein has got color in it. It's the blood in the vein, and we use the laser to destroy that vein. And this is immediately afterwards. You can see a little bit of post redness, but the veins are gone. And we can do this on the legs, the arms, the face as well.
And that's using heat. That's what's causing all of this.
Exactly. We're using heat, and for some of these, it's a little bit of a rubber band snap kind of feeling. So we'll use numbing cream to help, as well as with ice. Then the next procedure we do is where we get rid of blemishes, and this is on the surface, and we're using a procedure called intense pulse light. And I'll show you a sequence of a before, a middle, and an after, where we're using this to kind of really get the colors to come down, and it can take several treatments for this to happen.
Would these be like freckles, or are these sunspots?
Exactly, these are both. It's called a solar lentigines, which are age spots, liver spots, sunspots. They're called different things, but the thing that we have to tell patients about with this is that it'll look worse before it gets better. It gets a little bit dark and speckly, and then it just kind of sloughs off like a little brown scab over about a week. Okay. And so they do it several times to get the full appearance done. Okay. So the laser is a really interesting procedure. Then we can use a procedure called Tighten, where we're using a deep layer of skin to help tighten the skin underneath with energy, which is again heat. So you can see the before and after of what it does around the stomach. We can even do it on the face. So the next slide shows where we're tightening the skin right along the jawline. And again, it takes 1 to 2, sometimes 3 procedures, depending on the level of sag that the person has. But all these are lunchtime procedures, so they can really go back to work. And they're not dramatic to where they're all of a sudden seeing the result, but it happens over time.
Okay, now let's talk a little bit, we were talking about hair removal.
Right.
Let's talk about when people, sometimes they want those eyelashes to grow, they start to thin. What
This
can
is
you
a
do?
really neat new procedure or a new medicine called Latisse. And Latisse is actually an ophthalmologic medicine that was used for glaucoma, but they found that when it was put on the eyelashes, it actually made the eyelashes grow longer. So here's a before and after of 0 week to 16 weeks, where it really makes the eyelashes nice and full without having to do a lot of cosmetics to it.
Wow, that is a big difference
It's
there.
a big, big difference. Women just love it.
All right, can you put it on top of your head?
Now, it'll make the hair, you'll have to have more haircuts, but it won't make new hair grow.
All righty. And a lot of these, I mean, you've heard a lot of people having some great success stories and people feeling a lot better when this happens, huh?
Oh, yeah, exactly. They get a great response from it. And they just feel better about themselves.
Okay, well, doctor, we're going to let people know how to get in touch with you if they're interested in any of these procedures. When we come back, that's about it for this edition of NorthState Health, and we're going to take a quick break, and then we're going to wrap up with Dr. Ray Powell, today's guest. So stay with us. Well, thank you for joining us for NorthState Health. Join us each week at this time for another edition of our show. Now, for more information on our program, you can go to krcrtv.com/NorthState Health. There you will find information on all of our doctors, tips from the experts, and you can even watch entire shows from your computer. And that's important, Dr. Powell, because we always cover a lot of information. And today we did as well, talking about facial aesthetics and the different procedures. How can people get in touch with you? Where are your locations, and what procedures can people get done there?
Right, we have 5 or 6 offices now: Yreka, Mount Shasta, Redding, Red Bluff, Chico, and Willows. And really, any of the offices we can do the procedures at, except for the laser procedures, are done primarily in Redding and in Chico.
So, I mean, definitely there's a lot of locations all around the North State that people can go and have these done. And is it self-referral? They can call your office and they don't have to be referred by a physician?
Right, they can just call and set up an appointment.
Okay, and they come in and they have a consultation and kind of go over the options?
Right, we go through all the different aspects of their skin and look at what they're looking for, and then we kind of design a program for them.
All right, well, Dr. Powell, thank you very much for your time today. And we'll definitely be seeing you again in future shows. So definitely join us next week at this time, as always, for NorthState Health. And until then, have a great week.